Well, that's shocking. I made it funny. Get it? Shocking. Shock. Okay, I thought it was funny. Let's talk about shock. Another mini crit episode where we have a short conversation about something in relationship to critical care. So we're going to talk about shock and the 4 types of shock that you will see and or treat. This can be for anybody who is willing to listen. Anyone who is going to take care of a patient who happens to be at some level or some type of shock. So briefly, what is shock? Shock is when your body is unable to oxygenate tissue appropriately and is risking the possibility of end organ damage or cell death. End organ damage or cell death is literally what it sounds like. You are starving your organs of oxygen. For one reason or another, somewhere in your body is becoming hypoxemic, and is not able to function well enough to maintain homeostasis. Homeostasis could be a variety of things, the least of which is being able to maintain your blood pressure. The old traditional definition of shock is when your systolic blood pressure is less than 90, has gone out the door, and it's a good thing it has. So think about it for a minute. How many of your patients actually have a normal blood pressure when they're not sick? Do you really think the 90-year-old who lives in the nursing home, do you really think that particular patient's systolic blood pressure is normally in the hundreds? Normally in the 110s? Nah, probably not. Just like the obese, hypertensive patient probably doesn't have a normal blood pressure. They live in the 160s even though they're on 5 antihypertensives. So the true definition of shock in relationship to blood pressure has to do with a change from their normal. And you're going to have to know what their normal is or assume what their normal is. And that can be a little dangerous in the beginning stages of treating shock. All you need to know is that there has got to be a 15-point difference, or I believe it's upwards of 10% change in their blood pressure, systolic and or diastolic. But it isn't the end-all be-all. In fact, quite honestly, when I deal with someone who is in shock, blood pressure is usually one of the late signs of determining that they are actually suffering from a level of shock. So when your body is in shock, it literally is in shock. Okay, you got to stop with the bad jokes. They're really getting bad. What I'm saying is that they're literally shocked and not able to do what they need to do. So there's 4 types of shock, 4 ways that we classify shock. And we classify them and give them a description so that we have a general idea on how to treat them. What's the cause and what's the treatment? So let's talk about the first type of shock. And these are in no particular order. And I also should mention that these 4 types of shock, you can be in any of or all of them at any given time. So they could be in 2 of the 4, 3 of the 4, 4 of the 4, or 1 of the 4. And shock is a fluid concept. You are going to be in different stages and different levels of shock based on what you do for your patient and how your patient responds to that particular intervention and just how bad their shock really is. So the first type of shock, hypovolemic, and it literally just like it sounds, your volume is down. This is a tank problem, and the tank is not full with enough of the stuff to adequately oxygenate tissue and to support your organs. That could mean that they are dehydrated. Let's take the 90-year-old patient who lives in a nursing home. They either aren't feeling well or they just have no desire to eat or drink the food that they're given. So they decide not to eat. They can be hypovolemic. They can be dehydrated. And then when they come in, they're in hypovolemic shock. And they look like a dried prune. The other types of hypovolemic shock have to do with not being able to keep stuff in the tank. So the tank is emptying, but for some other reason. For instance, they're bleeding somewhere. So maybe they are on an anticoagulant and they're oozing blood from the inside out. Maybe they have an ulcer in their GI tract and it's oozing blood, so they have a GI bleed. Or maybe they suffered a traumatic injury, whether they had a motor vehicle accident, they were part of an assault and they had a penetrating trauma, gunshot, stab wound, doesn't matter. They fell, they broke a bone, and they've penetrated some sort of tissue or pleura within their body. And now they're oozing fluid and blood in places that it shouldn't go. So the tank, it's kind of like, there's a hole in the dam. You're going to have to do source control and plug the hole. Otherwise, it won't matter. You can give them all the fluid and blood you want. But if you don't plug the hole, it's just going to keep pouring out. And you're not going to fill up your tank. So you need to fill the tank. And if you have a broken tank, you need to fix the tank before you fill it. Okay? Moving on. Second type of shock is obstructive shock. These are literally the simplest names possible. Obstructive shock, something is obstructing your ability to oxygenate an organ. Now, it gets a little bit more complicated on what is actually being obstructed, but for the most part, it's fairly simple concept. Blood flow or oxygen or air, something is stopping the flow to allow your organs to be oxygenated. How do your organs get oxygenated? Usually by blood flow to that organ. So therefore, the blood is being obstructed in some way. So this is a blockage problem. Something is blocking, slowing down, impeding flow to wherever it needs to go. Now, it could be there's a substance that is blocking something from moving past it, or there is pressure that is compressing something down, which is slowing or impeding a process. Is when someone has a pneumothorax or a hemothorax. The positive and negative pressure that is on the outside and the inside of your chest wall and inside your chest wall between your lungs, your heart, and your rib cage, there's a hole there somewhere, so the pressure changes and causes a pressure to be unbalanced. There's an unbalance of pressure within your chest cavity that can compress either a lung or a blood vessel, more specifically blood vessels that go to your heart. So, anytime you have something called a tension pneumothorax, you're causing tension to shift from one side to the other of what's inside your chest. Remember, there's a lot going on in your chest. Everything from your trachea, your esophagus, your heart, your lungs, the pericardial fluid, pericardium, you have your pleural layer, all those things. If you have pressure or a hole created in some way, shape, or form, it's going to obstruct the flow of blood/oxygen. Okay? Another obstructive shock concept is the sac around your heart becomes so large and inflamed that it compresses down on your valves and your heart muscle, more specifically the ventricles in your muscle. So what normally should open and close like a normal size, you like my demonstration, don't you? What happens if the sac around the heart fills with blood or infected fluid, and now all of a sudden that ventricle that should open up like this is now opening up like a little bit of thing. So then, you know, you barely have any movement in your heart. So the blood flow is being obstructed because it's being compressed down. And last but not least, the final and probably most common type of obstructive shock is clots. Some type of thromboembolic event. You could have a PE or you could have a DVT. Now, it has to be a pretty significant DVT for it to actually cause a change in your hemodynamics and to affect shock state. But it's not unheard of. Most commonly large, and here's the really cool thing, is that the size of the PE and the size of the DVT, there's no correlation to what it does to the human body. Everybody reacts differently to clots. Some clots don't do anything to a human being in their blood flow. While that same size clot, put it in your neighbor or your friend or your family member, and they literally can't maintain anything, and they go into severe obstructive shock. So any type of clot has the potential to cause obstructive shock. Yep, I talk way too much. So in the post-edit of this video that I recorded, I talk about the 4 types of shock. I decided to cut it right down the middle. I talk about 2 types of shock in part 1, and I talk about the other 2 in part 2. So depending on when you catch this, whether you pick up part 1, part 2, make sure you check out both episodes.